Welcome back, all of you. So, finally, we have reached the last topic of this chapter. The topic is legal and ethical issues of aged people. So, as in case of any areas, ethics is a fundamental part of geriatrics also. So, ethics or the provision of ethical care refers to a framework or guideline for determining what is morally good or bad. So, ethics generally will find out what is good or bad. So the common legal and ethical issues in geriatrics involve assessment of decisional capacity and competence of an older person, identification of decision makers in his life, resolution of conflicts about care for the person, disclosure of information in critical stages, termination of the treatment at the end of life, and long-term care of an older person. So many legal as well as ethical issues we will be studying today. Although these issues are similar for all other age groups, the elderly place them at greater risk of adverse outcome because as the person is having a age more than 60 years, his capacity to think, capacity to make a decision loses. So that is the main potential. So the lack of support of family and friends make them especially vulnerable to the unthoughtful process of healthcare system. Along with that, even the family members will be very busy to take care of this elderly. So that again becoming a problem. So the physicians should assess each elderly patient individually and delineate treatment options accordingly. So physicians is having that power to assess these patients, elderly patients, and to advise a treatment option for them. So they also advocate for their patients' ethical interest as well as legal rights because they are the easy targets of unscrupulous victims and lose their property and money. So we all know that this age group persons are having the most chance to lose their property as well as money because they are unscrupulous victims. Unscrupulous means nishkalankam. So they are the easy targets. So healthcare workers recognize such issues and offer help and referral for legal assistance. So by studying this, you will be understanding what all things are there to help the person. So ethics terminologies. Ethics means declaration of right or wrong and what ought to be. Bioethics means application of the ethics to matters of life and death. Ethical dilemma means a situation in which a proper alternative or solution is not able to take. Whatever solutions are there, all the solutions are not satisfactory. So a difficult problem seemingly incapable of a satisfactory solution. Otherwise, a situation involving two equally unsatisfactory alternatives. That is ethical dilemma. So these persons will be moving through this condition. Finally, nursing ethics, application of ethical principles in nursing practice. So coming to the major ethical principles, I think you might study these things in other community or sometimes in psychiatry, I don't know. So autonomy, justice, beneficence, non-maleficence, veracity, substituted judgment standard, best interest standard. So one by one. First one is autonomy. Autonomy means freedom, right to self-determination, independence, and freedom. Autonomy is the personal freedom and independence to direct one's own life and make choices for and about oneself. So the older person is able to take decision for himself to live however he wanted to live. Respect for the elder's choice should be given in this. Second one, justice. Justice means, as the word says, obligation to do fair for all, beneficence. So the duty to act for the benefit of others. So whatever we are doing, that should benefit to others. Doing good theory. Non-maleficence or non-maleficence. That means do not harm or just protect patient from harm if they cannot protect themselves. Non-maleficence means do not harm anyone, or we have to protect patients from harm if they cannot protect themselves. And veracity means be honest and trustworthy in dealing with people. And next one is substituted judgment standard. So that means in some situation the person will not be able to take a decision by himself due to his health issues or maybe coma or unresponsive time. In that cases, a healthcare agent or healthcare proxy should be in charge to take the decision, surrogate decision maker. And finally, the best interest standard. That means the decision based on what healthcare providers or families decide is best for that person. So whatever decision is making, that should be for the best for that person. So these all are the principles of ethics, ethical principle.